Hey, my beautiful family. How are y'all doing today on this Sunday morning? To God be the glory. Let's get into what is actually happening. I don't want to waste your time at all. So please go ahead and hit that like, share, and comment. I just realized I don't even have my glasses on. I guess that's a good thing, right? I can actually see though. Except for the left eye. Can't see it all. Can't see a thing. So bear with me. So COVID-19 is surging again, they say. And these regions are facing the sharpest spikes. So I'm going to definitely tell you what states and what areas is spiking the most. It says you probably know someone that's dealing with COVID right now, or just got over that infection, or maybe you had it yourself. But COVID cases are high as kids go back to school. Folks return home from summer trips. It's part of the COVID pattern. The virus tends to peak in late summer and again in the winter. But just because it's part of the pattern doesn't make a COVID infection any less severe, they say, scary, or annoying than the years in the past. Now, there are changes to the COVID vaccine and stuff like that for those of you who are interested. I will touch on that just a little bit. They say COVID cases are high throughout the country, but don't discount that stuffy nose or what you think is a simple cold. Cases are particularly high in certain states. COVID cases are high in the following states: Texas, California, Oregon, Nevada, New Mexico, and other states in the west and south central part of this country. So they're seeing COVID increase in many communities across the United States, particularly severe, at least according to the current data. Now, the current data also can't be held up to 100% standards because of all the cuts that have been taking place with the CDC. So they say it's worth noting that COVID tracking data is less reliable now because of the COVID funding cuts, less testing, and the discontinuation of certain tools researchers relied on. While tracking is less accurate, it was a few years ago, or while tracking is less accurate than it was a few years ago. I told y'all I can only see out of one eye. COVID is surging in these regions based on the data that is available. So they're seeing cases increase in Houston and in Texas. And if we look at the data that is available from the Centers for Disease Control, it certainly seems like the South Central U.S., Texas, New Mexico, Oklahoma, Arkansas, Louisiana are seeing some of the higher test positivity rates in the country, according to Dr. Wesley Long. Let's see. And then according to Dr. Scott Roberts, an infectious disease doctor at Yale Medicine in Connecticut, the highest test positivity is in the Texas region, with the second highest kind of broadly being the West Coast. So the Washington, Oregon, California, Nevada areas, but that doesn't extend through Colorado and then the Dakotas. So folks in those areas are asked to take particular caution when spending time indoors, and certainly shouldn't assume any COVID symptoms like runny nose, cough, fever, headache, fatigue, sore throat are only a cold or allergies. Now, it could be, but it could also be COVID. So anyway, COVID cases are rising throughout the country, but rates are lower in the eastern U.S. COVID test positivity rates, which measure the percentage of positive tests out of all tests given in the United States, is 11.2%, which is up from 9.9 last week. That's according to the data that they have available. Let's see. The increased test positivity shows that there is increased COVID cases. It also means that they're probably not testing enough. So there's likely more cases out there that we haven't even haven't even suspect. So that's the thing. People aren't really testing like they used to test. They're not offering tests for free anyway. And then people, even with at-home tests, like I don't even know what the dates are on the at-home test. And like with my husband, he's like, I'm not taking that test. because he's the believer that, you know, it could be something on the test. So I'm not putting that in my nose. I'm not giving myself whatever. So everybody thinks how they think, and everybody feels how they feel. So I'm just letting you know what's actually going on. I'm not here one way or the other to tell you to or not to do whatever. So what's going on with the test? There's a lot of confusion by the new COVID vaccine guidelines. I went over those before. So let me just touch on it just a little bit. So not everyone is mandated. This particular group got to have this test like it was in the past. That has changed. They're not doing that. So the FDA announced new federal guidance for COVID-19 vaccinations, and that put a new restriction on how millions of Americans will be able to access the shot. So not everybody's going to be able to access these shots anymore. Health and Human Services Secretary Robert F. Kennedy, a longtime vaccine skeptic, outlined the new rules in a post on social media. The department officially revoked the emergency use authorization that has allowed the vaccines to be widely available since they first came onto the market in 2020. At that time, HHS issued new non-emergency approvals for 4 updated vaccines that are formulated to protect against strains of the virus. Who can get it and who cannot get it? Let's get to that. So it's saying here, seniors, for anyone who's 65 years or older, the rules haven't changed. They can still get any of the available vaccines from the same places that they've gotten them from in the past. Now, adults and children between the ages of 5 and 64, the most significant change in this rule is under the new guidelines. It is that non-seniors are now separated into high risk and non-high risk categories when it comes to how they can access this vaccine. Anyone with an underlying condition that increases their risk of severe infection or death from COVID can still get the vaccine from a pharmacy, doctor's office, or other vaccine sites. The list of conditions that put someone into high risk category includes chronic lung disease, heart conditions, diabetes, chronic kidney disease, immunocompromising conditions, and obesity. That list of conditions puts you at a high risk. So that will be available for you if you decide you want to do it. I'm not telling you to do it or not to do it. I'm just telling you what the new guidelines are. So don't get mad at me. Don't, well, you can do what you want to do anyway. Those who do not have an underlying health condition can now only get the vaccine after consulting their doctor. Pharmacies and other vaccination sites can no longer provide the shot to someone who isn't in the high risk pool. So if you just like, oh, well, I just want to get this vaccine because, I just want somebody injecting some stuff in me. You can no longer do it unless you are in that high risk group or you have already consulted your doctor and whatever, and they say that you can get it. You can't just walk in and say, okay, I want to get this jab or whatever. So young children, the end of the emergency authorization means that only one shot, the Moderna's is a new one. Moderna's Spikevax vaccine is available to children under the age of 5. Spikevax is only approved for children with an underlying health condition. So no longer are the children under 5 forced to get a shot, even if they don't have a, health condition that says, oh, they need to get the shot. There's no longer a COVID vaccine authorized for non-high-risk children under 5 years old. So, but they say those doctors may choose to provide the shot off-label in some cases. So, of course, medical experts are not in agreement with it. Some of them. Some of the most prominent medical groups in the country have criticized the new vaccine guidelines for creating what they consider to be unnecessary barriers. to accessing life-saving preventative care. So it's about preventative care, and they feel like, you know, if it's preventative care, then everybody should have access to it, not just a certain group having access because they're high risk. But anyway, the FDA has made a decision that completely contradicts the evidence base, severely undermines trust in science-driven policy, and dangerously limits vaccine access, removing millions of Americans' choice to be protected and increasing the risk of severe outcomes from COVID. The Infection Diseases Society of America said that in a statement. So that's what's going on with C19. So in my opinion, I really have an opinion on it. Is to each his own what you decide to do. But it is coming up on flu, cold season, C19, all of that. So just be careful out here, you know. And if you feel sick and you genuinely care about people, you don't want to get them sick, then just stay away from them, whatever. Go ahead and start stocking up on your cold flu medication. And outside of cold flu medication, get your vitamins and your herbal teas and all of those things, because not everybody wants to take medication to heal their body. So go ahead and start getting those things now. And pray, plan, and prep, you guys. So I'll see you guys in the next video. Y'all definitely take care and stay safe. I thank you guys so much for supporting the channel. It means a lot to me over here. You have no idea. I love bringing you guys news that you can use, store walkthroughs and things like that. Just different stories, period. I like bringing that to you guys, and I want to be able to continue to do that. In order for me to continue to be able to do that, I need you to definitely interact with the videos, as far as hitting the like, leaving a comment, or just a heart in the comments, and sharing the videos out. Otherwise, you may start seeing less and less of me. Anyway, so I will see you guys in the next video. Y'all definitely take care and stay safe. Bye, y'all. Thanks for coming in. I appreciate you. Look at my bun disappearing. Bye.